up, then do that.
So my click something there, yeah, just to give okay that it's okay to record.
So I've got to do that as well. Sorry, I just noticed that. Brenda, I thought the best way, well, what I have in mind is we'll have a quick look at you. I wouldn't mind just hearing a bit about how you experience the scoliosis. Then I wanted to show you a couple of things that are good to do before you do practice, or even if you're not practicing, just to do in a day that will really help release the spine. So that would be my starting point. Then we'll look at 2 or 3 common poses that come up in class and the way they should be adapted, and that you can then apply that to some other things. Obviously, we'll see how the time goes, but it would also be good, if I look at what I had in my plan, to go on to just showing you how you can use the breath to help you. And there's then this wonderful pose, which I say wonderful, it's quite hard work when you've got scoliosis, but it really makes a difference. I want to get that one in towards the end, just as something you can do for yourself that will make a difference, just on your own. So actually, before I get you to stand around, sorry, you might be feeling a bit uncomfortable there. Do feel like you can sit down a moment, because tell me about like day-to-day experiences of pain and or I don't want to put words in your mouth. Maybe you don't feel pain from your scoliosis, but yeah.
Yeah, no, I do. Lower back is painful. I was explaining to Kristyan the progress of scolio. I have osteoarthritis, so as I get older, it gets worse. And my lower right ribs are nearly on my right hip, so that whole area is very compacted and it's painful. So I try to, for work, I have like a standing desk. I try to stand, and I try to take lots of breaks. So I walk around a lot, which is very helpful. So the COVID was a great thing for me in that people started working from home, and I didn't have to be tied to an office. I do some like basic yoga poses, but I also do like unorthodox, just stretches that I know help. Use my kitchen island, like standing facing it, but right leg up, going that way, and then left leg up. And that seems to really release that area in the lower back.
Anything that helps, definitely do it.
Yeah.
So, sorry, just briefly, what do you do then?
I do IT work. So
okay.
Boring.
I'm sure it's not.
You're at a desk a lot.
Or on a monitor.
How long have you been doing yoga then?
Well, I was saying to Kristyan, it is a long time. So I guess it's over 30 years now. Iyengar yoga.
Yeah. Similar to me.
Also, I'll just interject there that Brenda did the classes with Corinna, and the remedial classes with Corinna and Judy. So brilliant. She has a level of fluency, but that was quite a long time ago, and I think that was before Elise's book came out.
Yes. Actually, Elise did come. I mean, Corinna helped organise that. So she came to Maida Vale and did, but I don't know if you missed those. They were just before COVID.
I did miss it. That was a shame.
Yeah, but that's not to say we won't get her back again at some point. So let's hope. Anyway, but let's. Was there anything else I want to say to you about? Yes, there was. You mentioned that you've had sort of people define your scoliosis or sort of describe it. So we don't.
I went to what was it? The orthopedic hospital a few times just to like keep a check on it. So I guess the other thing to say is through that I had X-rays done that show I also have a spondylolisthesis where one of the vertebrae is pushed forward out of alignment, which they were worried that would cause more issues, but so far it hasn't. I mean, I don't think it's anything worse than scoliosis, but there is that added complication.
Do you know where exactly that is?
It's one of the lower vertebrae, one of the quite big ones.
So lumbar or in thoracic, but lower you're suggesting lumbar sounds feels like.
I think it's lumbar.
Okay.
No, I'm sorry.
No, don't worry. I mean, I don't think it will change what I'm planning to do. It's just yeah, so I'm aware. Okay. So and yes, you've been described as having quite a long S curve. So I don't want. I mean, I was trying to sort of cut out some of the time where. So I may not get you to do the stripping off bit at all, but I wouldn't mind just seeing you standing because I've seen the photos. But if you just stand as you were trying to do a few moments ago, front, yeah, just so if you have your feet apart and try not to be yogic, just stand. I'm just going to shut the door here because I've got some noise. I can close that. Then here, yeah. So you can, yeah, just let your arms hang but in a natural way. Okay, and also then could you, yeah, so Kristyan, you look as well, and then if you turn around and just show me the back view, please, yeah. Yeah, and actually, would you mind tucking in your t-shirt?
Yeah, I mean, I can take it off.
Yeah, well, I don't know if that's necessary since we've obviously seen the photos, and I feel like I know what I'm interested in, and Kristyan may be able to tell me better because she's in the room. Can you see, Kristyan, if there's much difference in whether Brenda's left hip or right hip is forward or back, just by standing behind her and maybe even feeling?
Beside her or behind her?
Oh, behind her. I won't need to see for a moment, just so you can see. And you might, if Brenda doesn't mind, if you actually hold her hips, you might feel if there's. So I can see her left hip is a little higher, unless that's just the waistband, how that's gone.
Yeah, but, I'd say the left hip is coming forward a little bit, but
yeah.
Yeah, I think there is a bit of rotation.
Yeah, I mean, I would say that's a sort of secondary issue, but you think it's coming forward. That's interesting. So if you were just to stand briefly against, is there a bit of wall you can stand against or a flat surface there? Don't know. I didn't. You might need that, so don't worry if you can't.
There is. We can create.
Okay. Yeah, so I don't need to necessarily see, but Kristyan can be my eyes, and you can tell me as well, Brenda, when you're standing with your, as long as you can hear me, when you're standing with your back to whatever flat surface you've now got, and putting the feet, you might have to have the feet slightly forward to allow for your bum, but you want to feel which side of your, which buttock feels closer to the wall if you're just trying to let things go naturally. It might be they don't feel much different.
It's I tell you, it's hard because there's so much extra.
I think I
through
can
the
see.
shoulder, but it's
Go back to your. Yeah, I think I can. I agree with what Kristyan said. It looks like your left thigh just comes slightly forward, which means your left hip is slightly forward. That's fine. That just wanted to confirm that. I think the main thing is obviously your right thoracic, where, like you say, the shoulder and the where the main curve is, but it's still being aware of what might be happening at the hips. Great, we can carry on. So the first thing that there are two main things that I think would be really useful to do, or if you only have time, you're going to a class just to do one of them, if you're practicing yourself, try and do both. One of them, can you see my setup there? But you need, I've turned it that way so you'll be able to see what I'm doing, but the safest way to do that, I'm just letting Kristyan know, is, hang on Kristyan, before you set up, you actually need to do it with your feet coming to the wall. When you actually do it, your knees and your feet will be going up the wall and you'll be coming over this. So you need to be the chair a little bit in front of the wall.
Okay.
Jan will be able to check how if you just have a look at me. I'm doing it this way without the wall so that you can actually see what I'm doing. And I'll just move the camera a little bit lower. Okay, so I've put a couple of bricks at this end, so you could get it set up near a wall, but you have to imagine that where I'm standing now is where the wall, or maybe a bit nearer where the wall would be, yeah? So you come at it like this, and the hips are then, where there's a little bit of unevenness in the hips are then level. And you can keep your feet on the ground at this point, but obviously you'll be near a wall when you do it. So this then comes up, and where my feet and my toes have gone up was pressing the wall. It's just, you can do it like this, but it's a bit less safe. And then for you, and also for me, I suggest Kristyan will give us the feedback, but you might need the right hand brick to go lower, to bring the right thoracic lower, just to get more evenness there. But what this will do is release the spine. You've got the security of pressing these feet and shins to the wall and just getting, it's a bit like hanging from the ropes. I'm saying that for Kristyan, which I do every day, but if you don't have ropes.
I think you can do that to the at the studio. Isn't that what you do?
Oh yeah, do you hang from the, yes.
Yeah.
So do you have a studio you go to with ropes?
Yeah, the Institute has ropes and I have ropes at home.
Do you have ropes at home? Sorry, you have ropes at home?
I do, yeah.
Okay, so have you done, so let me just check then, we might not need to spend much time on the, obviously if you're ever going to a class or like at Kristyan's or, I don't know, it's useful to know you might be going away in a hotel room, someone's house, and just knowing what you can do to replicate the ropes is great. Just wondering, so in that case, it's the same thing. Can you see me here, Brenda, just for a minute before you get into the other one? So, have you done it? It's the same thing. I'm going into Virasana, kneeling here.
Yeah.
Keep the knees low. I'm wearing the wrong jumper here, really, but I can really immediately feel the stretch of my tighter waist there. And you could hang down. So, have you done that one? Do you do that one?
I have, and I tell you, in the last 6 months, when I come out of it, I'm actually the concave side. It's like I have pain through there. It's almost like I've underdeveloped muscles that then react to the stretch or something. It's something that maybe I could ease myself back into with some extra support or something. But I did kind of pull away from it, going, God, it hurts.
It feels too much. Yeah. So I think that's a good point. I think with all of these things, you're going to have to do a little bit, and just really, build yourself up. So you might not feel that till you come out. So bearing that in mind, do half a minute. Then if that's okay, try a minute, but then just stay with a minute for quite a while. When that feels like I'm not feeling it, you are going to feel it. So, but as long as the stretch is enough that you're feeling the benefit and not just the pain from it,
it's an I can't even describe it, but it's something I've noticed in the last 6 months.
So I'm going to get you to keep tucking your t-shirt in. I know it's not just the whole time, and then do you want to try the chair one so you know you've got but maybe don't do it for long, given what you said.
Let me try it, and then maybe I can better explain what I'm feeling. Maybe it's a different thing that's causing it.
So I'll leave my setup there in case you want to remind yourself. Oh, by the way, sorry, I did it quite quickly, but I do think you might need more layers than that to keep your hips comfortable. So I've put another blanket on top. So I've got folded mat and a blanket.
And you've got something on the seat of the chair?
Well, I don't think you really need it. It's just, I think that just ends up living. Let me move it. It just lives on I just have that on my chair without thinking. And then you have your 2 bricks here, which you could put them both at the same height, but when you get into it, the right brick could go lower. Yeah, and you need to be, so Kristyan, if you're standing by just to support the chair, just to start with. Okay. So you need to make sure you're on it high enough. So if I don't know what your height is, but if you need to go onto your tiptoes to get into it, so the very top thighs and the pubis are on the edge of that chair. Yeah, that's it. And then think about the knees coming lower and the feet lower, not higher. It's counterintuitive. That's it. And then let's see. What happens if you bring the right brick lower so that you're bringing that right? Yeah, that's already improved the look of the right thoracic.
Yeah, to move the left hand further away.
Yes.
Higher.
Yeah. Yeah, so you're familiar with that. So don't hold it too long. Breath-wise, we'll start with the breath straight away. Inhale, particularly into feel like you're lengthening, as you inhale, you're lengthening your left ribs, your left side. As you exhale, feel like you're broadening out from the spine along the right ribs sideways. So inhalation, lengthen the left ribs, extend there. Exhalation, going sideways out from the spine along the right ribs. And just focus on that for the next few breaths until you feel you've had enough of being on the chair. And what that does is obviously it helps you extend the shortened left side, and by breathing out on the right side, it should help soften the tighter muscles on the
It
right.
actually looks visibly quite different.
Yeah, yeah. So you'll come out. I think that's carefully come out because you'll really feel that.
And I feel, Emma, like if the chair is quite close to the wall, so you wouldn't tip back because you're.
Yeah.
So you got to get that sort of pivot of the weight you're engineering.
Yeah.
Yeah, there you go. Yeah.
Yeah.
Okay.
No, that actually, and that felt good. Maybe it's the breathing. Maybe I'm not breathing enough.
Yeah, well, the breath is crucial with scoliosis, and a lot. I think if you can start in quite a few of the poses, especially where you're a bit more resting, that one's stretching, but it's supported, that you're extending along the left side and outwards on the right, that will really help. Right, the next one is going to be, you're going to have a break while I get myself a tissue. I always get a ready nose when I teach. I'll be back. One sec.
So that you've got some water there. I'm wondering if it's not less extreme on the chair. You're not hanging from the rope.
Yeah, there's less weight pulling you.
Yeah.
I think you're right.
Yeah.
So that felt good, actually. That's when they do it on the ropes.
Guys, sorry.
Yeah.
Sorry, did you want to tell me what anything that were any more observations there before we go on?
No, I was just saying that it actually felt good on the chair, and Kristyan was making the point that maybe on the ropes there's more pull or more pressure.
Yeah, that's true, because you're a little bit more at the angle. Yeah, so maybe start again, but with the chair, and then if that starts to feel really quite comfortable or more comfortable, then you could, good point. The next one I wanted to do was dog pose, which obviously you would be familiar with doing in the ropes. So I'll show you my favoured way with scoliosis with the ropes, but you can also do it with the belt around the door handles. Have you done that before? Yeah. So you don't really need me to show that. Perhaps you don't need me to. I mean, I don't want to show you things you know. Do you? Do you know?
I do know the belts around the door.
Yeah. But these are the two that I would try and do. Like if you can get to I don't know how much time there is before a class that you have available, but just come into a room, start doing that with a chair, and if there was time and you had ropes to do the dog pose on the ropes would be the next one. But I would also.
I do have a little setup with the ropes. I don't have ropes, but I have I do have ropes, but I have
Do you put that around the door handle, or have you got
a pull-up bar? I use.
No, it's this is the lower ropes. So I would just put it around the door. Have you got a door there? So I didn't warn you about this, Kristyan, so you may not have a door handle.
I don't have it. I've tried it with the door handles that I've got, and it just slips out.
Okay, I think if there is Kristyan, it's fine. You'll be the the person. So just so that you can. So what I'll show you in my ropes. I'll just get this one out of the way. We'll briefly touch on it since you already know it. What I'll do though is I'm just going to tell my son he doesn't need to come and hold the camera at my door to show you, because you don't need to know. Thank you. Okay, so that's done.
Much better.
So do you, Brenda, do you normally do crossed ropes?
At the institute I do, and at home I've got the belt thing, so I tend to not do that.
I think cross strokes is better. I'm going to show you my pose, because I'm just going to also, 1 minute, my name is so long, I'm just going to change that so it doesn't take up space on the screen.
Hang on, we've got a little technical issue here. I've just done something.
Yeah.
We've lost you on the larger screen.
Okay. I'm going to get set up anyway while you're doing it.
There we are.
Okay.
So, just checking you can see me, not fully yet. So, again, it sounds like you may have been doing this with when you were back with Corinna. Was it Kristyan?
Yeah.
So in the ropes, and then I'm sorry you can't see me, but I'm stretching my arms up first and then I'm coming forward. And we'll see, having this hand higher, I've gone for a brick, it could be something lower like a pad block, for example. And I've got my heels up, a little bit up the wall, but because you've got the ropes, it's that stretching forward, but by having one hand higher, and I think you were saying I think that's good as well for you to take that hand out. But when I drop for me, it's a little different to yours, but it's my right thoracic is also raised. So I practice like that to I'll take my jumper off, but you can get the more levelness with the trunk that way. So before I get you to do it, because if you've done that with those adjustments, you might not need to do it. Do you use the ropes and do you use the, have you tried?
Yeah, I tend to have the 2 bricks and adjust.
Yeah, so you're used to that so I think really I would say making sure you add that in. If for Kristyan's sake you want to do it briefly with her being the ropes at your thighs, so Kristyan, you would just be like if you were adjusting a student with the belts, you can just have one belt around the front thighs and you're just
okay.
And then she can do the pose.
So one belt. Okay, so we'll do that.
Belt or rope.
We can do it here.
Yeah. Yes, if you do it so I can see you sideways, then I can see.
Okay. So
actually, no, you're right. Do it the other way. Yeah. So do it so that you're facing the camera, and I'll see what your ribs are doing. And because Kristyan will be behind you, I can be the eyes at the front.
So facing you this way, is that okay?
Yeah, that's perfect. So I got there in the end. Yeah. So you're going to put. You're going to double it, something so it feels very firm. And Kristyan, you're going to have 1 foot forward, 1 foot back, and really use your body weight to pull back so that, yeah. Okay, so do you normally do it with the brick so high, Brenda?
I'm
I start getting into it. Okay, so
Kristyan.
Yeah. So your challenge, Kristyan, is to keep her hips as even as possible. Given that her left hip tends to come forward, you might have to pull a little more on her left. Yes.
Oh yeah.
Yeah. Good.
I can really feel that.
Yeah, so you're getting the benefit from her pulling more on your left hip. Yeah. And again, I mean, I know it's hard work when you're in dog pose, but you've got some help. So keeping that work in the legs, obviously hitting thighs back, but then feeling the inhalation lengthening along, very long inhalation along the left ribs, right ribs broadening out on each exhalation. Yes, that changed things.
Yeah.
Very well. And maintain that, keep doing that. I'm watching. Yeah. I'm going to take a picture from here just with it's probably a more professional way to do it, but I'll do it with I'm going to have to send you this one as well. It looks great. So I won't make you hold it too long because you're familiar with it and there's new things I might show you, so carefully coming up.
Thank you.
Yeah, well done. So, yeah, I think so long as...
ask a question, I'm sorry.
Yeah.
So you, Brenda, say that the right ribs are resting on, so it seems it's counter, just for me to understand, if the right ribs are resting on the pelvis, then to move the left hip back almost feels like it's exacerbating that, but somehow it does appear to be.
Yeah, I mean, I know scoliosis is a complete minefield. It's hard enough to get your head around your own curves.
Yeah,
You can't see them in the same way. So I totally get your confusion, but I'm purely doing that because we both, and I think Brenda was aware as well, could see that her hips were not quite level. So levelizing them to start with obviously going to help the spine. But yes, then the other issues are being addressed with the stretching forward. And I think all of this extension, so from the ropes, from along the chair and the dog pose, the more that you can do that using the breath, that's going where you can feel that compression coming. So I think from what you're saying, it's this area, isn't it? Yeah. So you guess for you, that's I know it's my right ribs, but yeah. So that's getting that space, isn't it? So yeah, I'm talking about the breath there, but maybe we ought to think about the breath here for you as well. I think Kristyan is right. I wonder whether, well, the next things we can do, we can bring that in.
Well, I wasn't suggesting a change. I was just making that observation that I could definitely feel as soon as I put the rope on, you went into the pose, the left hip dropped. So
Yeah.
it is definitely this. I don't think you need to change anything in what you're suggesting. Yeah.
I think there's also weakness on that side, but you know,
Yeah,
it's just that it's not the muscles that should be pulling my ribs back and therefore the hip back are just not there.
Yeah. Okay.
The other thing, what was I going to say? It'll come back to me. Right. Yeah, so I think, oh yeah, I know what I was going to say is obviously sometimes you're going to be in class, there'll be a different teacher, not Kristyan, and so you might not have had time to talk to them about, you know, the way you wanted to practice. You just get on and do it how you need to do and explain to them after. But just say you're in a class and for your own reasons you're just doing it the standard way. Just make sure you're thinking when you do it. I'm just going to go on this mat. That so you know you'll be in the pose. And then you've got to remember that you're, for you, the left hip. So you're going to just try and use that left thigh. So you can do it without the rope as much as you can.
Yeah.
So you're doing the corrections even when you've got anyone helping you any props. Yeah. I would tend to have at least a block under the left hand to bring the right ribs down, and it make sure that at some point you've talked to the teacher about why you do that. If they don't like it, then decide whether you're getting enough from the class to carry on.
No,
yeah.
So be careful with my teachers.
Yeah.
So your left hand, brick under the left hand.
Yeah, and that's, if I show you on me, Kristyan, just so that you understand why, because I think it's conceptualising things as Brenda's teacher, you need to know, don't you? If I get a block rather than a brick for me. So if I go with nothing, I mean, mine is sort of like a balanced scoliosis. It's a left lumbar one with a right thoracic matching, so it doesn't look as visual, you know, it's not as obvious, but it's very much felt. So I don't know whether you'll see it, is what I'm saying. Hopefully you will. If I don't, I'll try to let it just show. So this should probably, my right ribs will be more prominent.
Yeah.
Yeah. So, and I can feel a bit of pain, Brenda, in the left lumbar and the right ribs, because that's the tight area. If I bring that up, then that already feels better because it's giving me here, and like Brenda does, a little out to the side.
Okay.
Like this. I don't know, could you see any difference?
Yeah.
Yeah. So that's why. Particularly when you've got the ropes, because you're getting that pull back in the hips. But right, so common poses in class. I'm going to look at Trikonasana and then we'll do a chair twist. Again, if you've done all this, you tell me and I can move on to something else. But I just think Trikonasana is one of those ones that comes around all the time. And you need to do it differently for each side. So in theory, we'll just see how it works for you. I don't know if you've noticed, you must notice the difference in the sides when you're doing.
Yeah, I've given up trying to go down. I just go out so I can get as length as I can.
Well, I mean, that's pretty much where I'll just move my camera up again now so you can actually see my head. That's pretty much where I'm going with it. On the right side, you might be able to go lower, but if you're already finding going out is better, thinking about this area, it might be. So I was going to say, on the right side, oops. Because the reason on the right side you might be able to go lower is because on Trikonasana you're getting more length here, which is generally more compressed.
Yeah.
So that might be possible, but if you're finding, you know, I'm not in your body, so if you need to be on a chair for that still, you could be. And on the left side, it's completely different. Now, let me think about actually, even with your hips here. I wonder also, now that I'm thinking about the way your hips are, So your left hip tends to come forward, doesn't it? So I think you might be better doing, when you do Trikonasana to the right, do it angularly.
Oh, okay.
With the left thigh and hip back. So then your arms are in line with your, as you know, sorry, I'm sure you're just reminding me. Now, the other thing that scoliosis, I mean, obviously, if you're in a class and you're doing it like the teacher's saying, fair enough. But for you, in your own practice, or if Kristyan doesn't mind and you're in her class, I put the brick in front because if you think the ribs are going backwards, aren't they? So if you bring the brick forward, then the ribs are already helping, getting that extra help to come forward. If you're on a chair, then you just bring the hand a little forward. So, do you want me to show you both sides and then we'll address?
Yeah.
On the left would be pretty much as you were saying, going outwards. Now, for you, you can probably do it classically with the legs because you don't have to worry about that left hip so much here because the right one goes back fine. But you're going to come over and then keeping that buttock in as always, but using your hand, now wherever the apex of the curve is, if you can bear it, so for me, mine's probably about here, push down and really, because then you're lengthening again this side, the left side. So if you want to see the difference, Kristyan, you could ask Brenda to do it with no adjustments, just Trikonasana as she would, well, as you might teach it in a general class, but or you could just, or we could just go straight to giving her the benefit of the adjustments.
Well, I think just go straight to doing it how with this suggestion, because then you can feel what the difference is.
Yeah.
So the left side I do like sort of like,
well, go to the right first.
Okay.
Yeah, but you can still have the chair there nearby ready. So do you use the chair both sides? You've tended to need that.
I tend to use it both sides. I just turn around.
Yeah. So just start with your left heel right back to the back edge of the mat. So if you're going to go angular, you might as well go fully angular. So your left foot is on the back edge of the mat, right near the window.
Oh, I see.
Yeah. And then the right foot goes right forward. And if you're not used to doing that very often, that will feel weird to start with, but I'm sure you'll get used to it. Yeah. So getting the good turn to, and get the right buttock in. And then the chair kind of needs to move, so it's going to be in line with where your legs now are. So you've got your glamorous assistant to
here.
a bit more point. Yeah, I mean it needs to point forward a bit because her leg is. You think where she's going. Turn the seat a bit towards me to camera. Yeah. Yeah. Just yeah. You probably don't need that mat. Is it annoying? Was that mat? Oh, the mat was over the chair. Yeah. Get rid of that. Yeah. Yeah, so the chair, when you're ready, you can take your arms out and obviously, I'm just doing my general teaching now, grip the right buttock in, and then take it. Maybe Kristyan might be able to help you move it because you're getting tangled up on the mats. Yeah, or you can just slide your hand along it. Yes, yeah. So that's, so let's see, yes. So that's
working to press the left hip back, yes?
Yes, so you're hitting the left hip back, and then for you, you've got that right waist issue, which I can see you're thinking about.
Yeah,
Just at the right waist. Yeah. So you're thinking about, again, with the breath, if I do it with you on that side. So it's inhaling. I mean, I know we were doing the other side, but just because I know Kristyan was, what she was mentioning, it does make me, and what you were saying about the ribs being near the pelvis, you need the space there, don't you? So
I mean, you can feel it. It's just there's a.
And for you, I tell you what adjustment Kristyan could give you. Yeah.
Yes.
You could help her turn as well, because obviously for her it's a struggle for her to turn her right ribs forward. So you can just put your hands on her back, one hand on the right ribs and one on the left shoulder. So right behind, and obviously just depending on what Brenda's feeling about how much she can take of that.
I don't feel, do you want me to go further with the right?
No,
I think
Just,
it's
yeah,
too.
just a gentle
But
rock.
what I wondered is whether the leg can move away. I've got my
Yeah,
dog.
that's a good idea. Yeah.
I'm
Go on.
wondering if I couldn't move the leg away.
Yeah, and then that gives them something to extend from.
Yes.
So if I come this way,
Yeah. Oh yeah.
is that helpful?
Oh,
Yeah, no, that's length, giving you more length. I'm going to take a photo for you. You can do that in the ropes, of course, which you will,
Yeah. Yeah, that's easier to do. Rather than just trying to move it, having the length.
Sorry, I'm coming back and getting my tissues again.
Is that okay, Brenda?
Yeah.
So yeah, that would be another good one to do.
Okay.
But it's in your ropes at home, which is great that you've got them, because I think that's the first thing for a scoliosis sufferer to have that. See, oh, hang on, we're doing the other way, aren't we? So used to my lefts and my rights being reversed. But yeah, so you're getting the tension on that belt there.
Yeah.
So if
Okay.
let's try the other side, because
There's
there's a few more adjustments you can make yourself.
So on this side, do I do the angled? Or
No, I don't need to.
Yeah, it's classic.
So if you think about it, because I think it's just getting it straight in your own head. If you're standing here, but it's your left thigh that goes forward, but this is the forward leg, so it doesn't really matter. Yeah. So turn that foot and leg out fully though, because the foot hasn't turned, your left foot, sorry. Even more, you could bend that left leg a bit more, turn the toes back towards the window. Yeah, get that. Yeah, just that, the usual that everyone has to worry about. Okay, and then the arms are, I hope you can have enough room, maybe, yeah, slide your hand along, perfect. But the top arm, rest that first on the waist, and then find the most protruding part of your ribs. Yeah, and yes, if you can cope with the pain of doing that. And you're pushing down, yes, and getting even more length, yes. There, that's great. And I hope the arm's not too uncomfortable. If you have space. Yeah, good. I mean, I'm going to take another photo of that because that looks great.
And the ribs are further away from the hip here, aren't they? When the right leg is back, it naturally opens up that.
So that's fine for that. So it sounds like you're essentially doing your Trikonasana with the chair going to the sides like that. So we're just adding in that on the right side you'll take your left leg back.
Yeah.
And on the left side you can be classical legs, but add in our hand on the ribs to push. Sorry, I'm poking my own, but you can't see me. I just realised. Yeah, so poking your ribs in. So let's use the chair. Or if you put the chair sort of facing the camera like that.
And are we going to use the wall?
No wall. We're just doing chair twist.
Oh, chair twist. Okay, fine.
And this would be applicable to all twists, but it's easier to get it on the.
Okay, so you turn the chair around.
Just have a block handy so that you can make sure the hips are going to be where you want them to be. So you're going to keep a block between your knees. Oh, sorry. If you notice me going slightly off camera, do tell me if I don't notice. There we go.
So we want the back bar of the chair facing the camera, yeah?
Yes, if you set it one more 90 degrees, yeah. And then, I mean, obviously then just, you don't have to do it yet, I'll do it to, yeah, go on. Were you going to ask something, Kristyan?
Sorry?
I thought you were about to ask something.
No, I wasn't. Can you hear okay? I've got the volume up. Okay, fine.
So I mean, I'm sure you know this from all your work over the years, but that stretch up to start with, and for you, when you're stretching up, you're thinking your right waist, because that gets compressed, so you're thinking lengthen there, and then you're thinking the whole of the left ribs, particularly the left ribs, which are the opposite side to where your right thoracic curve is. So you think right waist and like left ribs, those bits lengthen, and then as you exhale, squeeze your block and come and hold the chair, so you're turning to your right. And obviously draw the shoulder blades down. So now this, when you're, for you, because I might actually change my side, so I'm doing the same side as you, because with scoliosis, so you carry on with your right, and I'm going to do my right. You don't want to pull too much. You don't want to turn to the right very much. Any twist you do in any class, you already have a curve to the right, so you don't want to do a lot. So you're getting that stretch, you hold the position. What you're actually thinking of when you're hearing everyone else being told to turn more, you're thinking of moving the right ribs laterally in towards the spine. So you'll just have to sort of think about that. As you exhale, draw the right ribs towards the spine, and you can run your hands that direction, yeah. But not so that she's pulling more. It's almost like she's trying to not. Are you going to the right? You are, yeah, yeah. So she wants to feel like, yeah, the right ribs are going towards the spine, but she's not trying to turn more and more towards the camera. Yeah,
No,
that's it. Yeah, yeah, that's exactly that. Yeah, and it's almost like you're trying to hold yourself back. When you go to the right, you're trying to hold yourself back from going too far. It's almost like you've got someone's hand there and they're stopping you there. And but you've still got the lift. Anyway, and then we'll come out of it and go to the other side. Now, just thinking, there might be something we can add to that right side in a minute, but let's just do the left first. So the left side, this is where you can do some de-rotation, as my favourite scoliosis word for yoga. So you've got a rotation that takes you to the right. So any twist, when you get the chance to go to the left, you can de-rotate your curve. So we'll again go up, stretch up with the arms and lengthen that right waist and left ribs more and more. And then when you're ready, exhale, and again, you're coming. So I know I'm looking the other way, but I'm doing my left like you are. So now you're doing what you would understand you normally have to do in a twist, although you'll find it harder for you, but you'll inhale, lift, exhale, turning your right ribs forward, your left ribs back. And of course, since Kristyan's there, she can help you with that gently, so you're not, so you get a little bit of extra help. So yeah, just what the classic thing you would do to help someone turn. There's no problem, except she doesn't want to overturn, but sorry, she can overturn, but you don't want to cause any pain. So
the left shoulder moves back, the right ribs spread away from the spine. Just
like you would help anyone, because she needs to de-rotate. So she's now trying to de-rotate her. She's got a curve that takes her backwards to the right, and she's now turning the other way, trying to bring those right ribs forward.
Okay, so that's what the de-rotation means.
Yeah. So it's essentially, when you go to the left side, you're doing what everyone else is, but you get more benefit. Come out of it again. The other thing, you can't necessarily do it in a class, but when you practice, think of having 3 sides. What that really means is you do the lefts, on a twist, you'll turn to the left. So I would, if I'm in my practice and I have time, I would do this side first. I would get my de-rotation as much as I can, pull around, going to the left. I won't leave out this side, but I'll just do it once. And I'll be doing that lateral movement of the ribs in a way. I'll be holding myself back, and then just so that I've got the de-rotation as the last thing, I'll go back and do that one again. So 3 sides for you in any twist. Okay. Left side, right, left. Okay. Which would also apply to Trikonasana, for example, doing the left, going to the left, doing once on the right, and then the left again.
That's very helpful for me, because I found I did not know, I didn't know how to teach a twist to Brenda.
Yeah, and you know, there's quite a lot of scoliosis around. The people don't always know if you've got it in a strong way and it's obvious, but some people have it in a more subtle way. But if you then notice you yourself, Kristyan, that there's an imbalance, really those people. I mean, I regret my first 20 years of Iyengar yoga. I didn't know I had the scoliosis, and so I always just think, oh, I can do the left side much more easily than the right. But I was going too much into that curve that was already. Sorry, the other way. Sorry, I could do the right side more than the left.
Yeah. Okay, so Brenda wants to go twice to the left.
Yeah.
Trikonasana and twist. Okay.
And in a class, it's going to be almost impossible unless you've got a very small group for you to accommodate that, Kristyan. But unless you say do it at your own pace and fit that in,
Yeah.
but otherwise in practice, that's what I would. Yeah,
that's fine. But that's fine in class as well. Yeah.
I'm just thinking. I'm just trying to work my way. So for me, my left hip does the opposite to yours, and so if I show you, I'll show you for me. If I'm going when I'm going to my left, I will actually drop right buttock off the chair. So because I have the otherwise, I'm dropping down to the left a bit otherwise, but that way I can level. So I'm just wondering for you, when you're going this way
to the right,
that you might benefit from the left buttock being off when you go to the right, because yours is sort of coming forward. Maybe it's a little higher.
No.
But wouldn't it be? I hear what you're saying, but I'm
That's going to the left. Sorry, this way.
Oh yeah, okay.
The left side off slightly.
But that's what I do. But your hips do a different thing from mine. So that side, I think you need both buttocks on, Brenda.
Okay. Yeah, because otherwise you're going to shorten. I think it's the right buttock that should come off to create more space.
So that's so it's needing
the right hip and the right rib.
Yeah.
I'm wondering if you're trying that. Yeah, when you go to the left.
Yeah.
Does that
it does
space there?
It does.
Yeah, that's exactly it, Kristyan.
So that's a very good tip as well, isn't it? And basically, so no seated twist, because this is such a good use of the chair, isn't it?
Well, when you say, what do you mean no seated twist? Do you mean no floor twist?
Yeah, like instead of Parvajasana. Sorry?
I think we're using the chair just to understand it. Kind of, I would say in your own practice for a while, I would like focus on the chair twist till you really get your head round the different things you're doing. But then you can apply it. It's definitely easier in the ones where you're not swapping the legs around. But obviously, if you were doing Virasana, cross legs, you can apply it in the sense of I'm going to go to, I'm doing my left, so I'm going to go to the left first. By the way, BKS Iyengar always said for scoliosis people to lift the arms before you turn, and lift the arms with a particular focus. So for you, right waist, left ribs, just to get that stretch. Now, if you're in a class and you're doing that and they haven't told you to do it, you might get in trouble. But I mean, if you're with Kristyan or someone else who knows that you're working in that way, they won't mind.
Yeah, I'm only going to people I know.
And then I'm just thinking in answer to the question, because you know I am trying to show you some things that you can then apply in class. So let's think about Virasana 1. I'm just thinking thinking as I go. So I would always, for both me and you, Brenda, go to the left first if I can. But obviously in a class you'll often have to go to the right. But here, then, you can think in that same way about your hips. So for me, this hip drops anyway, which is the opposite for you. So I would be better to sit higher. I'm just grabbing what I've got to hand, so I'm just going to put something under to go just that bit higher to bring more levelness. But for you, and then I will be twisting as much as I can that way. When I go to the other side, and for you, the other side. So you're going to probably need more height, I think, under the right buttock to drop your left one down, which is similar to what we were doing on the chair. I'm really just showing you how you can translate this to what you might be doing in class, really. So you just have, so you could use the corner of a folded, thinking about what you're going to have easily to hand, corner of a folded blanket, just as an extra thing.
Yeah, okay. Yeah. Because otherwise, that can crush if the left hip is dropping, it's even
more compression
of the right ribs onto the right pelvis.
You for quite a while, Brenda, just say to people you're not really doing the ones where your legs, Bharavajasana, it causes imbalance. It's a pose that causes an imbalance. You're already dealing with an imbalance and you're trying to lengthen and straighten. So you'll be much better when they're doing Bharavajasana 1. If your knee, I don't know how your knees are, but if your knees are okay, I would do something like Virasana, because that's like more similar in position. But otherwise, do cross legs.
Yeah.
But this is level. Yeah.
Or the chair.
Obviously, the chair is definitely the best, just while you're really establishing all of that. And I didn't say, but what we were doing in Trikonasana, I would equally apply to the other sort of lateral standing poses. So, obviously, Parshvakonasana. Ardha Chandrasana is great, but I would use the wall, back to the wall, just because you've got a lot going on for stability.
Yeah, I tend to, the raised foot I put against the wall.
Yeah.
It's great for my hand.
Yeah. But you can then, so if you do quite a lot of chair twisting from now on, and you establish some of this, you can then apply that to all your standing poses, because you can be thinking, okay, my right ribs have got to come forward more here, but then on the other side, I don't want to overturn because I can. Yeah, I'm thinking that. Yeah, exactly that. I hope I'm not rushing through, but because I know there's a lot to take in. Luckily, you've done some of it before, which is great. So those were some of the common poses. So one thing that might be nice is just to look at the breath again, and then I'll get to that pose I promised you near the end, which you might not enjoy, but it will do you good. So, two things. Both of them are your knees okay? Do you have any bad knees?
I have been having trouble with my knees again. It's like everything's
Say that again.
The last half year.
What was that? You've what?
I had a big fall onto my right knee.
Okay.
And it's better in that I can kneel now, but it's sensitive.
Well, let's be nice to the knees. I have a bad knee, so let's have there's no problem having a bit of softness under the knees in Virasana. So I would have something, especially if you've had some fall. I'm going to get myself set up. I think I'm going to show you side on first. So I'll show you the normal Adho Mukha Virasana in a moment, but first, Elise Browning-Miller, who did she's got quite a severe scoliosis, and she did a lot of work with BKS Iyengar to help. She says, so I presume this came from BKS Iyengar, that for scoliosis, it's actually better to keep the hips higher. So I will show you how to adapt Adho Mukha Virasana, so you can do it with the buttocks low as well, but just showing you that she calls it puppy pose. So you're obviously trying not to drop the lumbar. But you can see that stretch comes, and then we can use the same, if I now come forward, we can use some of the same ideas in terms of the support under the hand. For you, even a brick, maybe because you've got more of a curve, your curve is more prominent on the right, because mine's more left lumbar, right thoracic, so you could even have a brick there and still go out to the side. But
can't see your hands here, Emma.
Sorry.
Your hands are just out of screen.
Oh, sorry.
I'd be interested to see.
It's just the same as I was doing, but yes, thanks for telling me.
Okay.
My brick has gone off the screen completely. I'll go even lower. Yeah. So I put a block there, but I'm thinking I sometimes use a brick even for me, so I think a brick might be better. You can have two to start with, or we might get rid of one completely, or have one higher, one lower. But if you try that sort of buttocks up, it's sort of like buttocks are not fully up, but they're not fully down. It's halfway. So if I go sideways again, so they're not completely forward, they're not completely down, sort of halfway. It's a bit inexact, and then with those bricks under the hands. Yeah, can I see your hands?
Sorry?
Can you lower the camera, Kristyan, because I can't see the hands either.
Ah, okay, there you go.
Okay. So,
Yeah, it's interesting.
Yeah.
so now your hands are level at the moment. So let's take the brick away completely from the right. Yeah. And then again, think about that breath. Inhale into, well, for you, we're going to add in the right waist and then the left ribs. I don't know if you can swap from the mid-breath. I'll tell you what, we'll do it two sides. No, forget that. Let's just focus on one side at once. So first, inhale as we were doing and establish that. Left ribs, left waist, left ribs, lengthen. Exhale, right thoracic sideways. So yeah.
Right spreads to the side.
Yeah, and then you can even help with your fingers, Kristyan, on the inhalation, just sliding your hand up. Yeah, as obviously we don't know exactly when. If you can feel when she's inhaling, just
Inhaling to
inhale, sliding your hand forward. Yeah, so that's you. Yeah, she gets that feeling, and then exhaling sideways. Yeah, that's it. That's exactly what you're doing. Now, obviously, there's. I'm just going to talk about this with Kristyan. Actually, stay there, Kristyan. Just stay there, and stay there, Brenda. Both of you. Kristyan, just take your. If Brenda, if you don't mind, if you put your thighs around her hips and just hold her hips, she might find she can enjoy the structure a bit more because you're there.
Yeah, because actually the left hip is coming forward.
Yeah, so you can help bring that back. Yeah, that's.
Brenda?
Yes, yeah.
So Brenda, that's something to bear in mind when you're doing
Yeah.
position. That you've got to remember to take your left hip back constantly. Yeah. Yeah, so it does smooth out your curve. It makes a difference. We can see that. Even on screen, I can see. I'm just going to take a photo again to show you if I can find. I keep putting my phone. Here it is. That's great. And then I'll let you come up because I want to show you how to, because then we're going to use some of the spare kit and sort of spare blankets and things that Kristyan has in just, if you were going to just join in with classical Adho Mukha Virasana, but you can do it in a way that, so for you, let me say you've got the compressed right waist here, so you might, I'm just thinking, I kind of have to get my head around mine and yours, scoliosis. So you might make a cone with, have you made a cone before? Oh, there's a lovely doggy. Have you made a cone before in one of these classes? So you just flatten the blanket, then bring a triangle across like that. Yeah, you got it pretty much, yeah. And then from that corner, you're rolling. So you end up with one narrow side and one. So yours is less cone-like than mine, but I have done it before.
So where do we start with it this way, yeah?
Yeah, I'm going to do it with you again. So you start that way, and then you just take, you did that bit fine, I think. It might have gone off. Then from, I don't know if I'm doing it right now. Then you start, no I am. Then you have to just roll that side a bit further ahead.
So this is going to be the point of the cone.
So, it may be that Kristyan, because she's in the room and can see things better than I can see what's happening, that this isn't the right thing for you, but it's an idea. But this narrow end of the cone, the reason we just have the cone rather than just a normal roll blanket is it can sort of get in the way, a big fat blanket. You have that there, and then now I'm going to use another blanket. You're going to have your blocks for your at the head end ready. I'm going to get another one. Here we go. You're going to have your differential bricks for your hands as we've been doing. So for you, higher, and we might even get rid of that one. Can you see all of these things? Yes.
Yeah.
This one is important because like me, you're going to have something that's going to go under the left ribs. And the point of that is that by raising the left ribs, the right ribs drop. So this one, we're hoping that helps with that compressed waist area. This one, your ribs come on. You have your knees far enough apart that you can actually go forward. And then as soon as I go down like this, I feel a stretch in the places that don't normally get a stretch.
No, it's good. Yeah, it's good.
Now we need to do something about the hand. So your right hand should be on nothing for you. The only issue that you have to be aware of in doing that. Okay, bring it in again. Actually, I'm just seeing what works. If you don't mind me carrying on fiddling to see what works best.
I ask about the blankets, Emma.
Yeah. Yeah.
So the one on the right is thinner than the one on the left.
Yeah. Well, that one on your thigh shouldn't really be folded. Should be folded, not rolled. I don't know. So it's just a fold. And the thing that I was trying to, the reason I was fiddling with your bricks, and I'm telling Kristyan because between us we'll hopefully come up with the right thing. What I'm trying to do is get the balance, as it were, between, obviously when you have one, you can see it on me, this has brought my left shoulder up, so I'm paying a price for getting my right ribs down, which is getting my left shoulders now a little bit higher than it and it's not the same level. But for me, that does bring enough release that it's worth it for me. For you, I was about to suggest something different for the hands, and I just need to see it again because your curve is in a slightly different place from mine. So let's see if we can perfect it, but be prepared that we might fiddle with the hand end. So I think she needs.
I feel like the right hand should be.
So sorry. So where the blanket is on. Sorry, I'm telling Kristyan, Brenda, you have to just be a passive victim at the moment, but do shout if it's feeling uncomfortable. I think you need an extra blanket or something folded on top. So you need two blankets where there's one on your left thigh, and the reason is at the moment your right thoracic is still higher, and it will be a little higher, but I want to try and bring the level.
So the second blanket will be
just on top of that one. It's just doubling up. Yeah. And the exact position is ideally, you might have to move it when Brenda's in, because we want to see what's happening in her thoracic and where her right thoracic is slightly protruding. Yeah, so that, now bring that left hand out to the side like you've been doing as well. So yeah, let's just see. And then
it's much smoother on the back.
Good. Just what happens again if we get rid of the right brick completely? That doesn't seem to help the right thoracic, does it? From here, what do you think, Kristyan?
No.
No, so you can bring it again. So sorry to mess around.
Now the spine is looking straighter without the right brick. There's more of a inverted spine, or a C shape of the spine.
And then this pose, if there's one pose where you do that breath work, this is the one. Once you've got the padding in a place that, so the other thing before we start doing the breath work is to ask you, Brenda, whether, does the padding under the left ribs feel, obviously Kristyan can see that the spine is straighter, but can you feel that perhaps the right ribs are able to drop down a bit more than they normally can?
Yeah,
yeah. So it's feeling that release there that you want. Again, Kristyan, you could help a bit by just gripping her hips between your thighs or calves.
I see this left hip is coming forward more, so.
Yeah, but then, I mean, obviously then it's really just giving you the time and space and quietness to inhale, right waist. No, sorry, I said I'd do it twice, so let's do it twice. We'll do left ribs, so extend, think only about lengthening the left ribs. Inhalation, left ribs, right ribs going sideways, like the whole thing we've been doing most of the time. So yeah, left ribs extending on the inhalation, yeah, and exhalation outwards, yeah, to the right. And I'll give you, so to do that for say 10 breaths if that feels sustainable. 10.
Is that okay, Brenda?
Yeah.
What I'm doing, holding there?
No, it's fine.
And I'll let you come up when you've done your 10, so no hurry. I just want you to feel it and get it in, the feeling in the body. But we'll then reverse the breaths, so I'm just saying that out loud so I don't forget. Not quite reverse, but we'll change the emphasis slightly. So, for you, you've also got that area of the right waist. So obviously the lengthening of the left side body really helps you to balance where the right thoracic gets tight and where the left ribs can be concave. So that's why we're doing that a lot. But you've also got this narrow right waist area and you want that stretch. So also you can sometimes take the inhalation, so you'll do quite a lot like we've just done, but then occasionally, or an equal amount, then move and focus the breath in a different way. So you'll inhale, stretching that right waist, feeling like the gap between the right ribs and the pelvis is lengthening, and then exhale. I'm not sure where to tell you to exhale, I'm just thinking about that. Probably just for balance sake, exhale along the left ribs, just so that you're getting the idea of the reversing of what you've just done.
So the inhalation to lift the right ribs away from the
Just
head.
to get more space, yeah, so more length there, because...
Or to think of also moving that hip away from the ribs.
Yes.
Yeah.
She's obviously got the cone there, hasn't she?
Yeah.
As well.
Yeah. Okay, so it's creating more space there.
Yeah.
The inhalation. And then the exhalation, Emma?
Well, I mean, the exhalation is almost whatever you want. I think you could just carry on. If it feels better for you, you could carry on the exhalations further up along the right thoracic, which is obviously still going to be a tight area. I just didn't want to cause too much confusion, because if you let me be quiet while you try and tell me, but right waist length on the inhalation and then exhaling, see how it feels carrying on the exhalation in the right thoracic.
I'm interested to hear what you think, Brenda, because what I'm noticing is that this time your inhalation is lifting the scoliosis curve.
Okay, I mean, I'm only, so come in that case, I was only adding that in because I was sort of picking up on Kristyan remembering what you'd said at the beginning about this narrowness here, but I think we have to go on both what you feel, Brenda, which I haven't let you have time to say, but what you're observing, Kristyan. Yeah. And I don't know if you felt anything that fits with what Kristyan was saying, Brenda.
Yeah, it's hard to like breathe into it. Doesn't really feel like there's space there, so I'm going up further.
So
when you were saying exhale going up, I'm thinking I'm already probably higher than I should have been.
And by contrast, the other way of breathing, sliding up on the left and spreading away from the spine, really levels the back out. So
that's very helpful for me to know. So let's stick to the breath as we've been doing it throughout. Let's scrub that last couple of moments trying that. And I think we'll just have to aim that length comes with the way of working that we've been
bringing the left hip back more may help and the upward rotation.
Now, end of class treat or not, depending. So you're going to need a bolster, a brick, and a couple of blankets. Now, I should say, it might be that instead of the bolster, you tell me and Kristyan that it's too much, and then you might have a rolled blanket, so you might end up with 3 blankets instead. So I'm going to show you it. It is quite strong, so I'm almost talking myself into starting you less strongly with it, but I sort of want you to see where you're headed. So when you do it, you would be bringing your, I'll show you side on as well in a minute, but I just want to show you how you use the wall. So you're going to, just check you can see, yes, you're going to have one brick which is by the wall, and then your mats will be along the wall. But now I'm going to show you side on, because, so you'll have to imagine I've got the wall here, and I'll move the camera down a little. Because I think you won't really see what I'm doing otherwise. So for both you and me, if I get this, my wall's moved, so I can get my head around it all. Okay, and then these are going to be like a pillow for the head. I'm moving other things out of the way. I've worked with one of my students who has scoliosis, who, she hadn't done lots of yoga like you, but she did have quite strong scoliosis, and she did say this was too much. But I think if you find it too much, this would be a rolled blanket instead of a bolster. These should be smaller than you folded them, so make them like that. So I don't know if those blankets
Yeah, we've got the blankets, yeah.
can you fold them into more, so half again?
Oh, half again, okay.
You're just making like a block-sized, can you, block-sized blanket?
Oh, this way. Yeah, sorry.
Yeah, that's it, we've got 2 of those. Right, let me show you. I'll enjoy myself. So, this foot is against the wall. The other one is, I'll have to show you the back for you as well, but this one's bent behind, and then you're placing where the worst part of the curve is, that goes against this, which might be a roll blanket if this feels too much. I'm about to collide with my stool, but let's see. So this arm then stretches out. It's anantasana, kind of adapted anantasana. And then you're putting these so that your head doesn't have to drop like that. This hand comes over. I'm going to hit all my equipment, but the top arm. So you again, that left side, which needs that length, we've been focusing the breath on. You pull there. And see, now I find this fine now, but I think I've probably done it a lot. After a minute or two, I'll probably start feeling, because essentially it's pushing things in that normally stick out. And, you know, my muscles will complain about that soon. However, I know it's doing me good. There's also a way of doing this, Kristyan, where you could let this top hand hold your ankle.
Okay.
Stretch there by walking away a little. However, subject to how copable it feels, tolerable it feels for Brenda. But yeah, with your feet to that bit of skirting board where you are would be good with the brick.
So the lower leg is bent.
Yeah, the lower leg is bent at 90 degrees. The top leg, which would be your left, right leg bent, left foot is on the brick on its side and pushing the wall.
Goes behind. That's it. And then resting on top of the brick.
Yeah, that's it. So then the thighs are alongside each other. Perfect. Now you're going to have to work out.
Is it at a right angle that way?
Yeah. The lower leg was at a right angle.
It is a right angle, yeah. Yeah. Then see what you can tolerate with the bolster. You need to get those blankets in on top of your arm, which Kristyan's going to assist you with, so your head doesn't tip. Both of them. And sometimes people need more than 2, but I think that might be okay for you.
Yeah.
Yeah, that's it. And then you can first of all hold your own. Can you reach your, and so you want to catch, the lower hand catches the top wrist, Brenda. Yeah. So the wrist. No, the other way.
No.
The lower hand catches. Yeah. So can you feel? Sorry. Yeah. Now, Kristyan, if you look at her, oh yeah, I'm going to look at her. Great. I mean, you look like you have no scoliosis. I just thought you would like to know in this, because the bolster.
Yeah,
yeah, and you know, it's in a way it's a form of torture after a while, but a positive one. And what we can get Kristyan to do, just stay there. I'll take a lovely photo because it's so good, and then we'll get Kristyan to add. just before you go in there, Kristyan, hang on, just step out a minute again, Kristyan. Just come out for a second.
Okay.
Sorry. I just want to face with this where you're seeing what you, because you're not always a helpful person standing by often. So yeah, now Kristyan can come and do her magic where she's, yeah. So, and then you just walk away a little bit if you can tolerate that extra stretch, but you get your lot going on. So.
Oh, I see.
Yeah. Yeah, and the top leg should be straightening.
Yes, yes, it should.
Press it to the wall. Yes, there you
Now
go.
make sure that that bolster's in the right place. It's now getting a little bit more to the waist, so just come out of it.
Yeah.
A bit. Come out of it.
Like when I straighten my leg.
Yeah, you straightened your leg and you got pulled that way as well. So between, you know what I mean? It's spending your time to get that. It's a palaver, definitely, to get in.
So it was.
Yeah, so let you get your own. Yeah. Now, can the top leg somehow rest on the bottom one? I don't know what you've done. It looks a bit different. And
yeah, I straightened it
not
out
completely. That's fine. That's fine. As long as they're in line. They're in line now. I'm happy now. Now you're holding the wrong way with the arms though. So forget Kristyan. Kristyan's going away again for a minute. Kristyan disappear. Just for a sec. Now, yeah, you've got to pull that top on. Pull. You pull it. Yeah. Yeah. I know you probably don't want to, but now. Still, I'm really sorry, but you still need to move that. So I wonder if you can do it by Kristyan just coming and pulling, just while you're slightly up. Can Kristyan pull the bolster a bit more towards the head end? No, wrong way.
Towards the head. Okay.
Yeah. I mean, as long as you feel it is pushing where the protruding ribs are, Brenda, but from what I've seen, I think that's right. But you can see behind Kristyan anyway.
Yeah, I think that's.
If it really wants, the top of the bolster needs to be the apex of the curve, is it or not, Kristyan?
Yes, it is.
Yeah, that's what we want. Yeah.
Yeah.
And can you take a picture from the back, Kristyan, if Brenda doesn't? You do what you're doing first, but then take a picture from behind, because I think I won't see that and then Brenda can see that.
Okay, I just felt like this hip should come back a little bit.
Yeah.
Okay, Brenda?
Yeah.
Yeah, then you're getting more work on that left leg as well.
So it's another one to be aware of, that left hip.
Yeah.
Keep pulling that top
And
up. And then yeah, you could just briefly let Kristyan take your so you can again, oh yeah, you're doing the back V like I said, thank you. Oh yes, nice. Yeah, so you don't look like you have a scoliosis. I just want you to know that. I'm going to take a photo there as well. Stay there, Kristyan.
Is that a good picture?
That's a really good one. Just stay there. I'll send you both these afterwards. Fantastic. Yeah. Isn't it worth?
And you wouldn't do that on the other side, would you?
No, you just do it this side. That's the only, only one-sided. So just briefly, while she's still there, because she's ready to come out, just let her pull your, because we never had it in quite the right place. Let her, that top hand can now come a little higher and pull your leg. Yes, that's it. But I think you're getting, no, I can see such a good stretch coming there. You probably suffering. You've held it a long time. Okay, I'll let you, whenever you're ready, come out and you probably need a little shavasana, but anyway, you've been pulled and pummeled a bit.
Well, thank you very much.
There's one more thing to tell you, and I feel like I'm trying to cram so much info in, and I hope that it doesn't confuse, but just ask me, both of you, for clarification later. When you do shavasana, this is the bit that might confuse because you're getting it all so quickly, but to really enjoy your shavasana, you prop in the opposite way to the way that we did before, because it took me ages to get my head around this, but so for me, if I go side, just trying to think where you're going to see the props going in. Yeah, I'll go this way. So I've got right thoracic issues as well. So if I lie back on my back and I can feel, so for me, my hips tip that way, which yours is the opposite way. So that's not great. And then I can feel the whole of my right ribs on the floor, but I can't feel anything on the left.
Yeah.
But the way to prop is not what you think. It's not propping under the right, tip it upwards. The way to prop that Guruji came up with was you're sort of filling in when you're in Shavasana, you're filling in, and also supine poses, if you're doing Supta Baddha Konasana or Supta Virasana, you're filling in, and as soon as you fill in, not so much that it's tipping you more, so you've got to be quite subtle about it, but the body, you'll know from how it feels for you, the body starts to relax, and I can now feel left ribs and right ribs on the floor. Because your right ribs are more protruding than mine, you might actually need to put more until you feel, yes, now I can feel my left ribs. You could have a folded blanket. But the reason I wanted to just mention that is I just think it's nice to really be able to relax in Shavasana, which you might not have ever really been able to do. So it's getting the edge of the blanket in so that you don't want to sort of throw the hips more than they are. But yeah, so now that's a bit much for me, but for you, that obviously your arms have to now be out because the blanket's in the way, but you might feel your left ribs can feel contact with something.
So Emma, this is when we were doing training, you would have a face cloth rolled up.
Yeah.
And is that what you use those small Pune tiny blocks for? Because we have those at Maida Vale.
Yeah, so for you might have a couple of these or even 3. They're little kind of covered pads. Those we get in Pune, but these, I've got these in England, they're called paninis, from John Claxton. He just makes them and you can order them, he's in Norfolk.
What are they filled with?
It's a bit firmer. So
it's what?
It's a little bit firmer than I think like it's yours a sandbag.
Yeah, this is, and I've got a couple of those that might be worth trying. Those, they look about the same size. You could give this
sort of roll the sort of a band, because these things don't stick out. You can just roll out a bandage.
Yeah.
I'm going to let you play with that because I've sort of thrown it in at the end.
And try with these. I mean, that's going to be too thick. That's not going to give to the body. These might. Sure. And we definitely have those little things.
Even just bringing in the corner of a blanket.
That's true.
Or face flannel, having 2 or 3 face flannels in your yoga space in your yoga bag.
You lie with your head that way, or is that your right side?
Move the chair there.
Oh no, sorry, the other way, so that the side that's being propped is visible.
Oh, yeah.
Have whatever you normally have under your head. I didn't show anything under the head, but whatever you normally have under your head, you should still have. Do you have anything normally? Yeah. So first of all, just lie there and you can tell Kristyan what you can feel in terms of rib cage contact with the floor and hips.
Yeah, the left side is not touching really back, although strangely it's more than it normally would be.
That's well, it's probably not strange after what you've done. It's probably already improving.
And then just try.
I don't know about those.
You're not sure about that?
There were sandbags. I'm not sure I'd use a sandbag. I don't know. Try it.
They're not. They're filled with. They're eye bags.
Oh, okay.
So they're very floppy.
Let's see what Brenda says because they might move around, but they might definitely better than
otherwise. Maybe this.
So what you should feel, what you're aiming to get to, Brenda, is as you lie there, you should eventually feel, okay, now my left ribs and my right ribs are touching the floor.
No, I think this is going to be better, and maybe.
Yeah, just not sure how far down to start being.
Yeah, and you might need to angle that blanket a little, Kristyan. Yeah. So you're probably not going to feel exactly even with the extra support, but you might feel more.
Yeah.
So
helpful.
You can feel something.
Unfortunately, it's not possible to levelize the arms here because
no. Yeah, clearly. But if you feel that some release,
I get the idea.
Yeah.
Brenda,
I don't think I've understood before about propping this, that it's to allow you to have something to relax down into.
Yeah.
And also
go on.
Also to feel the inhalation, right? So that the inhalation, the resistance of the floor on your inhalation is
You actually get
balanced, as opposed to just taking so much weight on that right side.
I think the only thing to be wary of when you're adding props into the left side is not doing it so much that you're making your turn to the right and you go even more. You don't want to worsen you. So you have to feel that yourself. And sometimes it depends on the day. Sometimes I'll think, no, I'm just making that worse and I'll just go flat with nothing. Some days I think, oh yeah, I've got the padding okay and it now feels like I can release the left side. So you just have to feel it yourself each time. And really, I think that one is going to be one that you have to try yourself because only you're going to know how
exactly. But it already, I mean, there's a real logic to that, isn't there? Because that, you know, it's interesting because I'm aware, I got a friend who's a Feldenkrais teacher, and I was saying to her, you know, my whole story has been about my knees. I don't have good knees. I can't. So I end up doing everything with my knees because the narrative about my bad knees is so strong, you know? So now when I focus on my feet, it like Chatushpadasana, there's no issues at all with my knees. So I think it might be similar with this, that if it's right side, right side, right side, the left side then gets forgotten. And bringing some attention to that left side actually helps both sides. That's what I think about the logic of it. But I mean, it might be wrong, but that's what it seems. So the pelvis is level 2 here.
And it looks very good, and it looks like you're comfortable. So you're either a very good actor, Brenda, or you are. I know I bombarded you, and some of it may end up being a little bit confused at the end because I know I don't think you're going to be easily confused, but I think everyone is in scoliosis. So sometimes we're padding, you know, if you're going forward, you're padding in the opposite way, you're padding under your left ribs and all of that. But if you really, what I was hoping to get to, so if I just summarize what I think we've done is things to stretch out before you do any practice, so that you start like 10 minutes of it if you can, so that or 5 minutes if you're in the class and you're just a bit early. So whether the dog pose or over the chair, eventually the ropes in that Virasana forward stretch. So stretching out the spine before you practice, then methods of practicing in the class so you're not making your curve worse and you're stretching that left side, and using the breath in those poses, left side inhalation, exhalation on the right, and then things like Adho Mukha Virasana, the puppy pose version where you don't have to pad because you're getting that stretch. If you're doing the classical, the padding to help get the sorry, my camera's not low enough, but to help get the derotation again in that pose as you're coming forward, you're padding here. And then we did that one. You didn't actually get a chance to say whether it was too much with the bolster. You sustained it for ages, but the sideways Anantasana.
No, it was good. It was very interesting. That was good. I was worried about that one. I thought it was gonna feel like it's too much, but
so and that's amazing. That I think that's testament to how much yoga you've done, because comparing you to my student who had done very little yoga, she just couldn't tolerate it. But I think you looked like you didn't have scoliosis, and that's the one to do. Like, so stretch out before class and practice, but in your practice, bring that one in. And even if there's no practice apart from that.
Yeah. And Emma, what about Brenda says forward extensions are really tough. So just concave stage in the forward.
Yeah, definitely. I would say concave, and then if you do want to build up, it would be the same kind of things as we've been thinking about in Adho Mukha Virasana.
Okay.
Definitely, because obviously your lower back you get lower back pain, don't you, from what we were saying at the beginning. But you've got, if I do it sideways actually, don't know which angle to go, maybe this would be better. As I come forward, if I come forward with nothing, then this is going to be higher, and for you it'll be a bit more like that. So having something for your head, that's a good start, maybe more, and a blanket on top of that. Padding this so that the right ribs can drop down. That already feels better to me.
Yeah. So that's the derotation.
Yes.
Yeah.
And
Okay.
It's sort of thinking, how can I, you see someone, and so if I say left ribs, right ribs, and their right ribs are higher, how can I help them get these right ribs down? Pad under here, lift that.
Yeah. Okay. That's
when they're coming forward.
Yeah.
I mean, ironically, back bends, depending on which ones, are not as problematic.
Yeah, that's
what I said. I quite like back bends.
Yeah.
So forward bends a struggle.
The ones that are better to reach are the ones where you start prone on your front and then you're coming up. If you're going into say Urdhva Dhanurasana, that's quite hard with scoliosis because one side is sort of dropping and then your hips won't be quite level either, so you've got that imbalance. But the chair would be the way, so at least you're keeping some levelness in the body because you've got the chair. But I mean, it's still a bit painful even with a chair.
What about I see you've got a back stretcher. Do you use that? Is that?
If I would use the back stretcher in preference. So, like if you're doing a chair, Dvipada Viparita Dandasana, I would always go to that. And actually, I haven't been going recently, but I was going to Abhijata's online classes for a few years, and she mentioned scoliosis a few times, and she said scoliosis people should use.
Okay,
it's another quite an expensive purchase, I'm afraid. I mean, probably £200. I don't know, depends where you get it from, but.
Well, I've got one which doubles as my coffee table.
Yes, you get a coffee table and a back stretcher.
My flat is so small, everything has to double up. But that's very good to know. So instead of chair back bends, we're going to get you on the back stretcher. Yeah.
That one we just did, with over the bolster, if you end up getting a back stretcher, just put the curve into that same, so you still have the blankets, you might have something to hold on to here or something.
You can see that.
Yeah, I mean, it's a bit painful without a blanket on it. But yes.
And if you were going over in the classic way there, Emma, you wouldn't build up the left side, or?
Well, you see, your hips, everything is, I think if I was going back the classical way, I'd have my feet to the wall, I'd put my feet I definitely use bolsters under your feet because your back is going to feel the pain otherwise.
Yeah.
So don't do it quite as I'm trying to do it here. But yeah, when I'm lying here, I would probably pad under, the right's going back, so.
On the right side.
It's a bit like the Shavasana.
Yeah, we build it up a bit, but in Brenda's case,
you feel some contact with the left ribs as well as the right ribs.
With the left, yeah, okay.
That was a bit of a crash course, so I'm happy to do a bit more on that if establish those sort of basic ones, but then either of you have got questions about those other kinds of poses for going forward, we can always.
I've just seen the time. I'm sorry, it's gone well over. I'm sorry.
No, that's fine. Well, it's fine for me. Brenda's probably had enough, but.
No, it was very helpful. I appreciate it.
Great. Okay, and then we've got the recording, and I'll remember. And if you send the pictures, then
I'll send the pictures. Are you okay to share the recording with me as well? And I won't go any further.
Yeah, of course.
Yes.
Yeah. Okay.
Terrific, Emma. Thank you so much. Lovely to see you. Bye.
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 Bye.